Good afternoon. This is Dr. Romero Salinas at Lincoln University, and with me are Jennifer Lutz from MU and Dr. Mohan Acharya, also here at Lincoln University. And we welcome this afternoon to Dr. Jessica Cowley. So she will be talking to us about very interesting uh, subject. So do you want to introduce by yourself a little bit and just to say what you will be talking for the audience?
Absolutely. Hi, y'all. My name is Jessica Cowley. I currently am a field service veterinarian at the Virginia Maryland College of Veterinary Medicine, which is at the College of Virginia Tech in Blacksburg, Virginia. So currently I specialize in reproduction, but kind of do a little bit of everything on farm animals. I don't know how in depth you wanted me to go, Doctor.
No, yeah, it's okay. You want to go uh, to share your screen, please.
Absolutely. So I was given the title of neonatal care and survival from conception through raising kids and lambs.
It is a little
So
bit,
I'm ready if y'all.
it is a little bit slow now. We are seeing now, okay, your PowerPoint. So before we were seeing now. Yeah, go ahead.
Okay, so the slide, you can see my slides, correct?
Yes, right now. Yeah.
Absolutely. Okay. Are you ready for me to get started, or
Yes, please.
is there
Yes,
something else you
yes,
need to
please.
do? Okay, perfect. Awesome. Thanks everyone for coming. It looks like we had a pretty wide range of locations of producers, so I'm pretty excited about that. I have lived, I grew up in Texas and then moved to Mississippi for about 9 years, Alabama, Auburn for three, and then now I'm located in Virginia. So I've kind of lived all over the Southeast. So I'm really excited to see so many different people across the United States and elsewhere. That's pretty exciting. So today we're going to start with pre-lambing, talking about vaccines and shearing and nutrition in some facilities, management for when we prepare for kidding and lambing in the United States. So the vaccine that I think we can all agree that every small ruminant is a requirement to have is the CD&T vaccine. Several different brands out there. Some of them are labeled for sheep and goats, and some of them are not. So I also just need to say in this PowerPoint, I will show different brands of things, and by no means is that because I support that brand, but that's just the one that I most commonly use. So I typically use this vaccine because it is labeled for sheep. So in discussion with your veterinarian, but I typically recommend boostering adult ewe and nanny goats CD&T vaccine about 4 to 6 weeks prior to their due date. And that just ensures that they have adequate immune response to ensure that we have the best colostrum available. In discussion with your veterinarian and depending on the farm that you're at and issues that you've had maybe in your particular location is abortions in your herd. And so there are a few abortion vaccines available. And if that's something that you've dealt with, discussion with your veterinarian can depict if you need to be vaccinating against any specific diseases. However, most of us don't recommend any vaccines just on a broad range, totally farm specific. With that, we're also going to hopefully shear, especially sheep. They do call it crutching, which is the shearing of a very defined region just for sanitary reasons. And depending on when your lambing season is, will depend on how much and how much you want to shear due to just trying to keep the ewe warm as well. But we need to do that at least a month prior to parturition or the stress of rolling that ewe up on her hind end like that to shear her could actually induce parturition. So it is best to try to do all of this at least a month prior to parturition. One thing that is very important that I see pretty frequently is a periparturient egg rise. Of course, we all are fully aware of the huge issues with internal parasites in the sheep and goat industry across North America. And so the quote stress that the immune system goes through in this late pregnancy, so the 4 weeks before parturition and the 4 weeks after having lambs or kids, is the highest chance of exhibiting a huge, really huge increase in the egg per gram that we see in those dams. So just keeping that in mind as you're working up these girls near parturition, as you're preparing for lambs and kids to arrive, is really making sure that you're checking those FAMACHA scores prior to parturition and immediately after they lamb and kid. Most of the dewormers we use are very safe to use in pregnant animals. However, if you read the labels on those dewormers, albendazole is not safe during the first trimester. So therefore, I typically recommend fenbendazole, actually at all stages of parturition. Or gestation, rather. I do use the wormx.info, which is the American Consortium for Small Ruminant Parasite Control, and I do really like this deworming chart that they have for goats and sheep. There's one specifically for sheep and one specifically for goats. Typically, we do recommend deworming with all three classes, but that, of course, is a subject for a whole nother PowerPoint presentation of deworming. But communication with your veterinarian and trying to establish deworming protocols in that near that lambing and kidding time is very important. So one thing that I started looking at is copper bolus. Now this is for both sheep and goats. And of course, depending on who you ask, it depends on how frequently you should use copper boluses in sheep. But most people do use them in sheep and goats. Of course, I have a whole lot more goat producers using them than sheep. But what it is completely safe to use in pregnant animals. So if you're dealing with groups of females that really struggle with that periparturient egg burden, you can absolutely use copper boluses in those pregnant females. The research articles that I found recommend only using the 2-gram boluses instead of the 4-gram boluses. And I think that's probably what wormx.info recommends across the board anyways, but other people can attest to that a lot more than me. But it is safe to use the copper boluses if you're struggling a lot with that periparturient egg rise. So I believe Dr. Stewart probably talked pretty heavily about pregnancy toxemia in these late gestation girls, but in general, most of these pregnant females need to receive 1/2 to 1.5 pounds of grain in addition to their regular diet in the last month. Now, this definitely depends on body condition score of these animals. So ones that are a little on the thin side might need a little bit more supplementation for that, and the ones that are a little higher may need a little less. Good quality hay is obviously very important, not trashy hay. So this needs to be some of your best hay available. Even though they haven't lambed or kidded yet, this is not the time to be feeding last year's hay that you've got stockpiled. This is definitely the time to keep that nutrition plane as high as possible right now without overdoing it. All small ruminants should be offered a sheep or goat specific loose mineral at all times, and definitely during this in ages of gestation, it's very important. A lot of people that I talk to say that it's best to have a loose mineral and just plain table salt available as well. That really encourages extra water consumption, which is very important. When you think about how much fluid is in that uterus during this time, it's very important to ensure that these girls are not getting dehydrated. And then, of course, when we talk about this after lambing and kidding during peak milk production, it is very important that we keep these girls functioning at top notch, and even just offering plain table salt and regular loose mineral can really increase milk production and weight gains for your lambs and kids. When we talk about facilities and getting ready for lambs and kids coming, are you lambing in jugs or are you pasture kidding? And both of those are, everyone's specific needs are going to be so different. So that one size does absolutely not fit all, as we all know, in almost any aspect of veterinary medicine. So those jugs really, though, they need to be big enough that there's ample room for a dam and her two offspring, hopefully, but close enough that those dams really do develop that nurturing and mothering and accept those offspring as her own instead of abandoning them. Making sure that we're cleaning out those jugs in between dams is obviously extremely important, and doing a complete overhaul at least 3 months prior, just to allow turnover of diseases, bacteria, and any other specifically bacteria that could cause lamb or kid early diseases as well. Most people say that if you're pasture lambing, then you need to have those animals on an ungrazed pasture for 60 days. So that pasture needs to sit empty for 60 days prior to when you're going to have lambs and kids being born. Again, just for biosecurity purposes, for these neonates that are so sensitive to anything. Depending on where what part of the country you live in and what time of year that you're lambing and kidding, most of these neonates are going to require heat supplementation, at least for the first 5 days. And again, this is totally dependent on what facilities, what kind of barns you have. But I found this really great picture of this creep area for the heat lamp that allows the neonates access to the heat from the heat lamp without getting the dams then cannot get close enough to burn their fleece. So this allows an area underneath this little gate for the lambs to get up underneath the heat lamp, that then the dams are not able to just bump the heat lamp, knock it down, burn their fleece, etc. So I thought that was a really good idea for jug management. When we talk about pre-lambing diseases in the dams, there's a lot of things that can happen to those dams that can influence the outcomes of the lambs and kids. So I wanted to just touch on a couple of pre-lambing diseases that it's extremely important to not only consider the health and viability of the dam during these diseases, but also the potential consequences that these may have on the offspring. So things like vaginal prolapse, we obviously deal with quite frequently. And while most of the time we don't, well, most of the time we don't think of vaginal prolapses as something that's going to cause issue to the fetuses. It totally can, especially if those dams are having vaginal prolapses immediate prepartum time period when they're actually in stage 1 labor. Pregnancy toxemia is a whole cascade of metabolic issues that originates because the fetuses don't have enough nutrition and are pulling so much nutrition from the dam, causing obviously severe issues for the dam, but as well as the fetuses. So if a veterinarian's involved in these diseases, trying to assess heart rates in the fetuses, making sure the viability of the fetuses is maintaining during these diseases can be important depending on the severity of these diseases. So then I did just want to touch on abortions. Obviously, abortions is actually something we deal with a lot more in small ruminants compared to our larger ruminant counterparts in the bovine world. But when we think about abortions, the big things that we need to look for is honestly any kind of vaginal discharge. So anytime we have abnormal vaginal discharge when we don't expect it, and that can be normal in color, it can be odorless at this time, but if it's at a stage of gestation that we don't think there should be vaginal discharge, which should really be never during a pregnancy, then we need to be concerned that there's something else going on. Lamb and kid deformities, we don't deal with that often, but when it does, we should probably start thinking about signs of abortion. And when we talk about some of these abortifacient diseases, depending on what stage of gestation, what stage of pregnancy those diseases occur in, we can also have lambs and kids born full term that are not alive or have deformities at full term. So some of these things don't happen early. Sometimes we see abortions that are actually stillbirths and have lambs and kids that are dead upon arrival into this world or die very shortly after. So probably the most important thing that I want you to remember is that almost all of these abortifacient diseases are zoonotic and transmissible to humans. So I added these my questions to the bottom here, and so I think this is when we should answer one of the multiple choice questions. So I'm not entirely sure how that works. The next slide, we're going to go in depth about what to do when you think you have an abortion. But the main thing that I need everyone to understand is that, especially for female humans, if you're pregnant, you should absolutely not be handling aborted fetuses or the fluids that come with that fetus, as they can cause human abortions as well.
Can you, for me, launch the question?
I'm sorry, can I what?
Yeah, I will be launching the question.
Okay, great.
So the people will be answering, and after that, you can give some feedback.
Oh, sure. Okay.
We have like a 60% of the people answered already. 80%. Okay. So do you want to give some feedback? So the people are very smart. Yeah.
Sure. Yep. So again, a lot of these abortifacient diseases can cause abortion in humans and other ruminants as well. Very contagious between sheep and goats, but also to cattle as well. Some of them are the same diseases that cause abortions in cattle. So if you have a dam that aborts, and again, we expect really some level of abortion in sheep and goats. Most people consider a 2 to 5% abortion or stillbirth rate acceptable. So as long as we're staying under that time period or that percentage in your herd, then I wouldn't, as a veterinarian, I would not be too concerned about it. But if we've reached that percentage or we're over that percentage, we definitely need to start doing some diagnostics, trying to figure out what's going on. So again, because these abortifacient diseases are contagious between small ruminants, between dams, it's important for control measures so you don't have an abortion outbreak in your herd. You need to separate the dam that's aborted from all other pregnant females, ideally for 3 weeks. I completely understand that depending on your facilities, that is sometimes very easy to do and sometimes not at all easy to do. But in an ideal situation, that's what would happen. Any bedding, straw, hay, sand, dirt that has been soiled by those aborted fluids really should be buried 6 feet deep. Again, I understand in a frozen tundra situation that is not always doable, but that is what we recommend is the best option. There's not anything necessarily to do for the specific dam that has aborted, besides monitoring her for fever, increased rectal temperature, or if she goes off feed. If either of those things happen, she starts having foul smelling vaginal discharge, communication with your veterinarian about maybe some antibiotic administration would be warranted. So if you start to have those increased levels of abortion or stillbirths, and you do think you want to try to pursue some diagnostics, then double wrapping that fetus and a portion of the placenta in a garbage bag and contacting your veterinarian for diagnostics. Those samples need to be kept at like refrigerator temperatures. They don't need to be frozen. So maybe just having a disposable styrofoam container to keep them in where it doesn't get frozen but can stay at kind of refrigerator temperatures. Just for your knowledge, we typically say that we can get a diagnosis in about 50% of the cases we submit. So by no means submitting these samples will slam dunk get you a diagnosis of what caused these abortions or stillbirths. But it's definitely worth it if we start having increased numbers and trying to control this from spreading throughout the rest of your herd, because obviously that can be really detrimental in a lambing or kidding season to start losing a bunch of lambs. So when we talk about normal parturition, it's helpful to remember that the fetus, actually the neonate, triggers the parturition process. And depending on the age and how many are in the litter, if it's a singleton, twins, maybe triplets, definitely has an influence on how long this process lasts. We typically divide the act of parturition into 3 different stages. Stage 1 is kind of that preparatory phase. Maybe the dam loses their cervical plug. Stage 2 is expulsion of the fetus. And then stage 3 would be passage of the fetal membranes in the placenta. We know that sheep and goats and neonates can be kind of positioned multiple different ways within that uterus, within the birthing canal. So this pictures demonstrate what would be the absolute best way for them to come out. But oftentimes these animals are delivered, quote, backwards. And the dams have no issues, but we can definitely run into issues if these fetuses are malpositioned, maybe have a leg back, a head back, coming butt first. So when we think about how long this should take, so I consider it a dystocia or a difficulty giving birth if the dam goes into that stage 2 parturition. If her water breaks, she's trying to expel the fetus and she shows no progress within 30 minutes, intervention by either you or a veterinarian is, I consider, necessary at that point in time.
Okay, I will launch question 1 now.
For those that may not be able to see the poll, because every class we have some that can't, generally like to read the poll to them if you don't mind, or I can if you do mind.
I don't mind at all. So this is, unfortunately, I did not put my questions in order of the presentation. So this is technically question 1. And when a ewe is in stage 2 labor and not making any progression, how long should she be monitored before intervention? A, 30 minutes, B, 2 hours, C, 3 hours, D, 4 hours.
Can you give feedback? Why not 2 hours or 3 hours?
Yep. So the whole process can take about 2 to 4 hours, depending on where she is. Younger ewes will definitely take longer than older, but that stage 2 labor, if once she breaks her water and tries to expel the fetus, that should happen rather abruptly. And so my rule is that if you've monitored her for 30 minutes and she shows no progression, There's no, the fetus that had feet out and now there's still only feet, no head. So she shows no progression in that 30-minute time period. I think intervention is necessary. That way, by the time that a veterinarian gets there, if that's what needs to happen, and it's been an hour, we're not going to lose those lambs due to a dystocia malposition, or the lambs don't die in utero.
Will you think that will be the same for goats?
Yes.
Okay. Thanks. Yeah, go ahead.
So again, anytime, I'm sorry, do it.
No, go ahead. Yeah. So.
Okay. Anytime we need to intervene, appropriate PPE such as OB gloves and latex gloves should be worn at all times. Again, some of those diseases that cause abortions or stillbirths in sheep and goats are transmissible to humans. So I just need to say that you should always wear appropriate PPE when performing OB work in small ruminants. So if we think we have to intervene, there's multiple different like devices and things that we can use to aid in getting a leg up, getting a head coming the right way. And some of these I actually make my own rather than using some of the commercial products available for cattle because they're really just too big. Chains really do work very well. When you think about the physics of chain links and how it distributes that weight, that is absolutely the safest thing that we can use when we need to apply pressure to a limb in pulling a calf. However, it is very difficult to find chains that are small enough for sheep and goat dystocias. And so I like to use this braided polyester rope because it's polyester. It can actually be sanitized by soaking in a Chlorhex solution or other such solutions. And so I like to make little leg ropes out of this rope here. And then I can attach that to a limb if need be and aid that. Add gentle traction in order to keep a limb exteriorized so the shoulder doesn't go back down when I try to pull that limb. Head snares can also be bought. There are commercial small ruminant head snares. And then again, that can be made out of a rope with a knot tied in it just to keep it from slinking all the way down and choking the animal. But these really do become very helpful when you've got a nose pointed down that's catching on the brim of a pelvis. And by any means, when we deal with some of these, big production sheep and goats, it's somewhat fairly easy to get an arm in the pelvis. But when we start talking about some of these smaller breeds, sometimes there's just absolutely no way that we're able to manipulate these fetuses vaginally. And so unfortunately, depending on the size of the dam really does dictate how much intervention can safely be performed. My personal, if I can't rearrange a fetus within about 15 minutes, then discussions are had with the owner about moving to C-section. I do believe that small ruminants just cannot take as much vaginal manipulations as a cow, for instance. I think their uterus is a lot more friable and we deal with uterine tears a lot more frequently. When those fetuses enter the world and we start resuscitating them, I am a huge proponent of not hanging the fetus upside down. This is a very contentious subject across the veterinary field, so I totally realize that. But what we know actually happens is when you hang a fetus upside down, the GI tract actually pushes on the diaphragm and prevents the lungs from expanding. And oftentimes that fluid that's coming out is from the abomasum, and so fluid that was just naturally in the stomach anyways, not actually for the lungs. So things that we do need to do as soon as these lambs are born or we're seeing them struggle to breathe a little bit is set them upright rather than laying them on their side. If we set them upright, we call that sternal recumbency, and that allows both sides of the chest to expand and both sets of lungs to open up. You can kind of pat the sides of the chest to stimulate the diaphragm to contract. and you can suction that airway. I absolutely stick my finger down their mouth to try to get them to swallow, get a gag reflex, clear out any of that mucus that might be in there. And using a human bulb syringe is extremely helpful as well. In clinic, I often have like surgical suction that I can use to suction that airway, but the human bulb syringes are extremely helpful as well. The other thing that we can do in resuscitation is there is an acupuncture point kind of on the middle of their nose that actually stimulates them to take a breath. So I use this fairly frequently if I have neonates that are kind of struggling to breathe a little bit. You do have to have a very, very small needle, but as long as you have like a 22 gauge needle and you actually put it right in the center of their nasal, it's phalange is what it is. And so it's just kind of in between their nostrils above their upper lip, actually. I realize that this is a picture of a calf nose, but that's what I had.
One for me to launch the question 3?
Yes, sir, please. So this is technically question number 3. And so when resuscitating a newborn lamb or kid, a method that should not be used to aid in fluid recovery from the respiratory tract is A, hanging the lamb upside down, B, patting the sides of the chest, C, suctioning the airway, or D, sitting upright in sternal recumbency.
Yeah, I think most of the people answer. So you want
So the correct answer again.
Yeah, go ahead.
Oh. Correct answer would be hanging the lamb upside down. Again, this is kind of contentious across the ruminant industry, whether you're talking to veterinarians or producers, but I'm a proponent of not hanging the neonate upside down. I do think that that actually hinders them to breathe just from the weight of all the intestines, and the fluid comes out is actually from the stomach that they had swallowed in utero rather than from their lungs. So anytime we have a neonate born, it's very helpful to kind of go through this checklist of abnormalities that can happen in these neonates and making sure that we're not dealing with any of these congenital defects that can form. So one of the most common ones that you may or may have not seen is called a cleft palate. And this is actually incomplete closure of the roof of their mouth. So the picture on the right here is a really great double cleft palate in a lamb, I believe. So what happens is the roof of their mouth has a hole in it. And anytime they try to suckle, the milk actually goes up to the roof of their mouth and then out their nose. And that they can then breathe it in because it's now in their nasal tract. And so they oftentimes get pretty severe aspiration pneumonia. And sometimes this cleft palate is so severe that the neonates actually are not able to nurse appropriately because they can't get that suction on the teat because they're missing a good portion of the roof of their mouth. So some of these are big words, but atresia ani is actually missing of the sphincter and so of their anus. Therefore, they are not able to pass feces because there's actually not a hole to the outside world. Umbilical hernias can be very common in sheep and goats, or incomplete closure of the umbilicus as well. I have seen actually a hole and intestines herniated out right next to that umbilicus. Contracted tendons can occur in sheep and goats where typically the front limbs are affected and they kind of walk on their little knuckles. Their little front legs kind of curl up underneath them. And in mild cases, if they'll stand kind of on their toes, they will actually fix that in a day or two. But in severe cases where they're walking around kind of on their front knees, we usually just splint those front limbs for 3 or 4 days typically, and those limbs will come out straight. Heart defects are actually fairly common in sheep and goats, and neonatal, so are like very early in the first few days of life, deaths can actually be caused from heart defects, and they weren't oxygenating appropriately and die from that. Cyclops and parrot mouth can occur from different toxins actually, but All of those are, depending on the severity, can hinder the lambs growing older. So talking to your veterinarian about what might need to be done for that animal's best interest. Entropion, we're going to talk about later, but that is a fancy name for the curling in of eyelashes. And so their little eyelashes can actually poke them in the eye and cause issues. And I have a slide on that a little later. Naval care is very important. And so making sure, that we have clean facilities. When your environment has less bacteria in it, when your environment is clean and dry, that decreases the amount of bacteria exposed to that umbilicus. But most people definitely recommend dipping the navel cord in either iodine or chlorhexidine solution. Both of those products are very commonly used. I think most of the horse literature is leaning more towards chlorhexidine solutions at this point rather than iodine solutions or dilute betadine solutions. But in the ruminant industry, there's really been no difference noticed. So I prefer 1 to 2% strength of dilute betadine rather than a strong iodine. That 7% solution I think is just way too strong of a solution, actually causes tissue irritation. The blue stuff, chlorhexidine at 1 to 3 dilution, 1 part chlorohex to 3 parts water, tends to maybe have some longer antimicrobial effects compared to betadine. But while we're dipping the cord, it's very important to look for abnormalities around the cord. Again, making sure that there's not some other portion of hernia, either complete or incomplete, that's occurring. So some normals, I think it's always helpful to talk about our expectations. So when we think about the normal neonate, lamb or kid being born, they really should be standing within 15 minutes of birth and nursing within 2 hours. So many sheep farms report lamb loss of around 15%, and that seems really high. And so, but having an idea of what your specific lamb or kid loss is, trying to compare that to kind of a global or a nationwide average is very helpful so that you know where you're at. Are you below that number, at that number, above that number? And as that changes for you year to year, that really lets you know, okay, is this a year that I need to consult with a veterinarian and do a bunch of diagnostics, trying to figure out what's going on? Is there something that I can do to decrease this number, or is this about, am I average? Of course, age of the dams and their health obviously influences this number a lot. Some people are starting to look at actually some genetics, and they wonder if that early vigor and suckling ability of lambs might actually have a genetic component. Unfortunately, that's very early in some research, but we think it might have a genetic component to that. So then huge issues we deal with in small lambs and some newborn goats is hypoglycemia, which is low blood sugar, and hypothermia, which is low body temperature. So those are the fancy names for those conditions, but that is the 2 biggest issues we deal with newborn lambs and kids. So if the neonate is less than 5 hours old and they are cold, they probably just need to be warmed and then fed colostrum. If they're greater than 5 hours old, you may need to consult with your veterinarian. They may need more assessment, and they might also have low blood sugar and need some glucose supplementation before we feed them colostrum. So the easiest way to kind of boost that blood sugar just a little bit is putting Karo syrup on the gums of the neonate. But if it's so severe, they may need IV supplementation from a veterinarian. Typically, when those lambs and kids get below 98 degrees Fahrenheit is when we actually see some severe clinical signs. So the biggest thing that can happen, and this happens in all neonates, puppies, calves, you name it, If their body temperature gets below 98, 95 degrees, their intestines actually stop working. And so therefore they cannot move ingesta through the GI tract. So if we actually feed them when they're too cold, we can cause huge issues because they bloat is essentially what happens. Their GI tract is not working and they can't move that colostrum or milk we just fed them down. Neonates actually have heat production from two mechanisms. So newborn sheep and goats have what's called non-shivering heat production. And so that's from the fat tissue that they're actually born with, which is a different type of fat tissue than what they produce after they're born. So older lambs can actually shiver, and then that shivering process metabolizes energy sources, and then that's how they stay warm. However, again, those newborn, freshly born lambs don't have that shivering ability. And so those, what we call brown fat tissue reserves, actually exhaust within 6 hours of being born if they haven't ingested any colostrum. So this is just one of the reasons we're going to talk about more, but this is one of the reasons why it's so important that these lambs and kids get up quickly, nurse quickly, especially depending on what environment they're in, and try to stay warm. And again, it's why we deal with cold lambs and kids so commonly. So we define hypothermia as anything less than 98 degrees, and this can even if they don't measure 98 degrees on their thermometer, they can actually exhibit signs of being too cold if there's confounding factors such as environmental stress, shock, weakness, if we fed them with a cold milk replacer, if the dam doesn't know what to do and she's not licking them dry. And so when they're wet like that, that increases how much their body has to keep them warm if their fleece or hair is wet. So making sure you've got something available to warm these neonates is very helpful. Heating pads, circulating water heating pads are much more expensive, but they're actually really effective in keeping these neonates warm. If you have to warm a neonate, I do want to be careful about and warn you about dunking them in warm water. Again, then you have to be sure you're drying them off quickly after that process. But you can actually heat them up too fast. And that doesn't happen very often, but it can. So
I
think
do
we're ready
have the
for question number
questions here if
4.
you're ready. Okay.
So question number 4 is when feeding a newborn lamb kid colostrum, one should ensure which of the following prior to tubing colostrum. So the lamb is standing on its own. B, the lamb's temperature is greater than 98 degrees. C, the lamb has a strong suckle reflex. Or D, the lamb hasn't already received colostrum.
All right. I'm going to go ahead and end the poll.
So when we talk about feeding colostrum, and I've got a couple more slides on that, but the lamb does not have to be standing to tube colostrum. You do want to make sure that it's in an upright position, but it does not have to be standing. The most important thing when you tube feed a neonate, especially colostrum, again, I'm not talking about milk replacer later in life. I'm talking about within that first 12 hours of life, making sure that they're warm, or else tubing the colostrum is going to be pretty ineffective. Oftentimes we have to tube colostrum when the lamb or kid doesn't have a strong suckle reflex. That may be a reason to actually tube the animal. And then there's really never a reason to not give colostrum. So even if it has received colostrum that you think, it's never going to hurt for them to receive another dose of colostrum. So when we talk about colostrum, it's so important that these neonates receive that first dose within 2 hours. Now, they need to receive the full, quote, amount by 24, but we're going to talk about why 24 hours might actually be too late. So making sure that they've received colostrum, ideally within the first 2 to 6 hours of life, is extremely important. They need about 10% of their body weight in colostrum. So that first feeding, again, ideally within the first 2 hours of life, should be 50 mils of colostrum per kg body weight. And I calculated that out for you in mils per pound because that math can be difficult. And then a total of 200 mils per kg in that first really 8 to 12 hours of life. I mean, it has to happen within the first 24 hours, but honestly, the earlier the better. Alternate sources of colostrum. Now, a lot of people will bank their own colostrum, which is probably the ideal situation on your farm. So if you've got a heavy producer, if you've got a dam that has a singleton, maybe milking her out after the neonates had a good chance to nurse and actually freezing that colostrum. It's actually just good in a regular old standard freezer for up to a year. If you're purchasing this from someone in an ideal situation, would be maybe testing this for some diseases that can be spread through the milk. But I realize that gets expensive and is sometimes just not feasible in situations. But so if you have to purchase colostrum replacers, be sure that when you go to the store and look, again, I'm by no means recommending this brand, but I want you to look at the packaging. And when you purchase colostrum from a store, it needs to be a colostrum replacer, not a colostrum supplement. It needs to be a colostrum replacer because it needs to have a certain amount of IgG, and that's the protein that actually is the important one in colostrum, present, or else you're not feeding enough. So following these package instructions very closely is important when you have to supplement colostrum from an alternative source. Typically, I'm tube feeding this colostrum, and I just use, it's called a French red rubber catheter. You can purchase these from places like Valley Vet Supply or from your veterinarian. I connect that to a catheter tip syringe and I just allow gravity flow to feed the neonate. So the first thing that I do is I kind of lay the neonate in my lap and I measure the tube from its nose to the 13th rib. Kind of mark that with a Sharpie or with my fingers, and then I sit the neonate up in my lap. Depending on how big it is, I just drape it across my legs or drape it across a hay bale. Advance it slowly, let it swallow to the mark that I made, and that's how far I pass it. I don't pass it any further than that, and then give however much colostrum is needed. So when to feed colostrum? Again, the answer, immediately after birth. We really prefer this to happen within 6 hours, and it is mandatory within 24 hours. So when we look at this graph, the reason that it's so important to get colostrum into these neonates early is actually very early in life, the intestines of these neonates are actually not fully closed. So these really large proteins found in colostrum, that's the most important things in colostrum, can actually travel through the gut wall and is actually absorbed into the bloodstream of the neonate. So gut closure begins at 24 hours of birth. Therefore, colostrum given after is just not going to be as effective. But if you look at this solid blue line here, you'll actually see that the efficiency of the absorption across the intestines peaks at 6 hours. And beyond that, the amount of those proteins that absorbed across the gut wall drastically decreases. And again, is completely gone by 24 hours of age. So this is why it's so important that historically we've taught colostrum within the first 24 hours. And that is not a lie. But we really need to get colostrum into these animals a lot earlier than 24 hours for maximum efficiency and just overall longevity and health of these neonates. So when to feed colostrum? So the obvious answer is, well, if the dam's dead, if the dam didn't have any colostrum, is an obvious reason to feed a lamb or kid colostrum. But some other times to be concerned that maybe this neonate didn't receive enough colostrum is small, if they're born the runts of the litter, if they're weak. Very large ones actually have difficulty nursing enough within that first 6 to 8 hours to actually absorb all the colostrum they need to. Some of these floppy neonates that just don't have the get up and go, litters of 2 or more lambs or kids, young or inexperienced ewes. I mean, that comes with a whole host of issues, but some of those girls just don't have the quality of colostrum some of our older ewes and does have. So thin, old, sick dams, very thick colostrum. Gosh, I've seen some of this stuff. It really does look like cake batter, and these neonates actually have difficulty swallowing it. Some of our older dams get what I like to refer to as bottle teats. And so if you have a neonate that's maybe too small, or a dam that just has a lot of milk production, and that neonate actually can't wrap its little lips around the teat and nurse effectively, you may need to milk out that dam and actually tube it colostrum. Typically that remedies itself once the neonates grow a little in size, but again, it's very important within that first 8 to 12 hours of life that they can nurse effectively. So if you have an orphan that you do need to bottle feed, these 2 slides are for you. Typically we say they need 15 to 20% of their body weight and 2 to 3 feedings a day. Weighing these neonates frequently, which you can actually, those baby scales are not all that expensive, but it's even cheaper to get a food scale. And most of these kids and lambs can be weighed on a food scale. A lot of people used to use 10% body weight divided out in however many feedings a day, and we realize now that we were actually starving some of these neonates. So making sure you're increasing that to 15 to 20% of the lamb or kid's body weight, spread out however often a day. I like to use milk replacers that are specific to lambs or specific to kids. There's not a lot of difference between lamb and kid milk replacer, but there is a lot of difference between small ruminant milk replacer and calf milk replacer. So I really like to use species specific milk replacers, and I've had pretty good luck with the Pritchard nipple, which is this red and white nipple you can find for sheep and goats. Here's just a basic age versus amount feeding in ounces, and then how often to feed that. So this is from a textbook that I just really liked, a veterinary textbook that I like to reference. And you can see that as they increase in age, we really need to increase the amount of ounces that we're feeding these animals. So again, if you're shopping for milk replacers, make sure you're buying a species-specific milk replacer, ideally one made from whey protein or milk proteins rather than soy proteins. Reading the instructions on the back of the bags, making sure we're mixing it appropriately, and making sure that these neonates always have access to fresh water. They're probably not going to consume a lot of that just regular water, but if we inappropriately mix those milk replacers, we can actually dehydrate the animal. So making sure they have access to water is important. So when you have a newborn lamb and you perform an examination on it, again, normal. Does it stand within 15 minutes? And when it stands up after being asleep for a little bit, does it actually stretch? Those are all normal things. If you're worried about if the lamb or kid was born too early, if it's half-baked, making sure that their little bottom two-furs have erupted. Neonates that are born too early and are they have real silky ears and kind of droopy ears sometimes, and their teeth haven't erupted. Their incisors haven't erupted. Making sure that they've defecated and passed that first feces called meconium is helpful. And sometimes I have had to give some kids and lambs enemas before, just with warm soapy water, making sure that they pass that meconium. Do they actually stand properly? I have a lot in the area I live now. I deal with some lambs, especially that that they're very weak when they stand, and so they're kind of floppy. They don't hold their head straight, and they don't stand evenly on all four limbs. So that can really be an indication that something is going on here. Whether that's they're dehydrated from a metabolic issue, or is there like a muscle or musculoskeletal issue that they've got. Checking out those legs and joints. Are the legs straight? Do they bear weight appropriately and evenly on all four limbs? Do they have enlarged joints? One joint bigger than the other, one knee bigger than the other. Comparing them to their twin, if there is a twin, making sure that everything's just symmetric. Looking at that abdomen, are they real kind of tucked up or too full? Do they look almost like they're bloated? But probably the most important indication of if you have a healthy lamb or kid is, are they gaining weight? There's no rules out there of, oh, your lamb should gain this many ounces a day. And unfortunately, we just don't have that really for any neonates out there. But as long as they are gaining weight and not losing weight, then that is probably a healthy animal. So that's a very easy thing to be done, is weigh the animals once a day, even every other day. Making sure that they're gaining weight is a really good indication that they're healthy animals. So this is entropion. Here's some good pictures and diagrams for you. So entropion is the fancy word for inturned eyelids. So when you're doing that kind of initial exam on a newborn neonate, making sure that those margins of the eyelids are normal and their little eyelashes are not poking them in the eye. We do consider this an inherited defect. So if you start having multiple siblings have this, I would not make that mating match again. So if you've introduced a new ram or new buck and you start seeing a lot of entropion, might want to consider not using him, at least on those females again. So if you find this immediately after birth, you can sometimes fix this by actually kind of pulling the eyelid out and then applying a little bit of pressure, like you're doing a FOMACHA score in an adult. And repeat that 2 or 3 times within the first 24 hours. And that will usually roll that eyelid out and those eyelashes won't poke them in an eye anymore. Now, if it's not corrected in the first day of life, or it just your efforts were not able to correct this, then oftentimes veterinary intervention is corrected. There are some clips out there that you can buy online. I've never attempted those myself. As a veterinarian, I typically tack these with some suture, but there's multiple ways described to fix this for sure. But catching this early is always better. So joint ills, kind of what we call joint swelling or infections, which is very common in our neonatal lambs and kids. So this is typically from not getting enough colostrum early enough. Making sure we have that clean environment. We're not soaking up bacterial through those umbilical infections, because that bacteria actually seeds itself to the joint fluid. And so that's how we get these swollen joints. So making sure these animals are bearing weight on all their limbs, making sure, again, their little knees are symmetrical. One's not bigger than the other, and oftentimes they're hot when they get infected. So consulting with your veterinarian and maybe getting some antibiotic in these creatures, the earlier the better. So very often this is not a hoof lameness in these small creatures. It is unfortunately actually an infection of the joint space there. So one thing that I see now in the region of the country that I live is floppy lambs from white muscle disease. So this is actually a selenium deficiency. Selenium is found in the soil and in plant stuffs, and depending on what region of North America you live, depends on how much selenium is actually present in the soil. So in the Southwest Virginia, I actually deal with a lot of selenium deficiency now. So if you think you live in a selenium deficient area, talk with your veterinarian about Injecting lambs and kids with BOCI injection is the most common product to use. I typically recommend this within the first week of life, and depending on, again, what area you live in, within the first month of life as a second injection. Typically, you will see floppy or weak lambs and kids, but unfortunately, oftentimes it results in death. So again, having some diagnostics performed on these weak and dying lambs and kids can be very important. So if you have a dead lamb, the biggest thing that I can tell you to do is keep records. Making sure you're writing down when this happened, the age of the neonate when it was born, appearance if it was actually born dead. Keeping track of how many dead lambs, stillbirths that you have can be very important when discussing with your veterinarian how to prevent this in the future. Did the lamb exhibit any illness prior to death? What was its weight when it died? And then, of course, if you have records of weight gain for however many days it was alive, the age of the dam, was there illness in the dam? All of that can be really helpful if you start having an increased numbers of dead lambs or dead kids, and really helpful in trying to diagnose what the underlying problem is. So when we think about lambing and kidding season, a few supplies that I would tell you to have on hand is clean towels. And thankfully I work at a university where I have a washer and dryer dedicated to washing those towels. But having clean towels available is super important. Heat lamps are important, especially if you've got orphans now that you're having to deal with. Whatever navel dip you and your veterinarian have discussed, having a way to tube these creatures if they're orphans or if they're just not ingesting colostrum fast enough. Always having some form of colostrum replacer on hand, whether that's frozen colostrum that you've backstocked or a commercial product. A thermometer and syringes and needles are like so important. My Walmart is not open 24 hours anymore, so making sure that you have that on hand prior to when you actually need it. Discussing with your veterinarian and kind of having a medicine cabinet. Antibiotic is probably the most important, but discussion with your veterinarian and what problems you have on farm is very important. So this is a picture of a little sack that can be used to carry lambs. I tell people all the time, and of course I work with a bunch of students. So when I'm talking with my students, they all want to pick them up like a little puppy dog underneath their armpits and around their stomach. And that is probably not what you want to do in a newborn lamb or kid. Putting pressure on that abdomen, if there is a problem, can cause some huge issues later down the road. So making sure you're picking them up by their pelvis or their sternum, and not just one leg as well, can be important. Most of them tolerated okay, but picking them up by their sternum in between the front legs and then in between the back legs, or using their pelvis to actually lift them, is the best way to lift a neonate. And rigging up some little carrying device like this is super helpful if you have to move the dam as well, because typically they will follow their neonate. So if you can rig up something like this that looks pretty natural as the neonate walking away, the dam actually follows you pretty closely behind. So some helpful resources that I use to put this PowerPoint together and that I find really helpful for my clients is honestly any extension website. These guys that are logged on here, they do a really great job of writing extension articles that are super helpful to aid you in all endeavors of sheep and goat production. I do like this manual of lambing techniques. It's actually from the UK, but I really like it. I think it's got a lot of info. I'm sure you've all heard us harp on this website a lot, but wormx.info is just the best website to get to seek knowledge and information on deworming of small ruminants. And then I also like plug for the Maryland Extension website. So that's sheep101.info, and there is the sheep201 as well. And that's just a really good basic website that if you're new to this industry, highly suggest checking out that website and doing some reading for yourself. Happy to take any questions. There's my email address. If there's something that you need deeper thought of, or if you need me to email some of these resources, happy to do that. Again, such a pleasure to get to speak to all of y'all. Yeah, again, looks like there's a lot of people from a lot of different regions of the United States. And that's really awesome that y'all are all interested in this. And kudos to Lincoln University for reaching this many people via Zoom. So I see there's
Dr. Cowley.
lots of questions.
Yes, I have them. I have them for you.
Yes.
So you don't have to go scrolling through the chat.
Awesome.
I gotcha. So early on, there were a lot of questions about copper. Can you talk again about
Sure.
size copper bolus is recommended for goats and sheep or kid and lambs? And there were some questions about the different dosages.
Ooh, sure. And that is a hot topic that I will refer you to the wormax.info website. So there's a pretty great, if you go to that website, there's a pretty great, I believe if you go to resources and then maybe hot topics, but copper bolus is a whole, there's a set of articles on that website about copper bolus. So I believe, now double check me on that website, but I believe the last time I read that for adult animals, they were recommending 2-gram copper boluses for adult sheep and adult goats, kind of pretty much regardless on weight. But again, I would read that website because I am by no means, there are people a lot smarter than me when it comes to that. So I would consult that website, and it looks like the industry standard is 2 grams. 4 grams was actually too much, and it didn't induce copper toxicities. I know we all worry about that, but it actually was ineffective at decreasing that worm burden. Unfortunately, I do not remember how much it recommended for young animals less than a year or less than 6 months. I know that I personally keep 0.5 grams and 1 grams on my truck for using copper boluses in those younger animals. I try not to use a copper bolus in anything less than 6 months, but I have definitely used them in animals less than a year of age.
Okay, and then real quick, are there any differences in copper recommendations between like hair sheep and wool sheep?
No, at this moment in time, there are no different recommendations in sheep versus haired versus wool. Now, thankfully, I think that's coming, and we do. In the haired sheep, thankfully, they seem to be a lot more resistant to those internal parasites, but that is totally dependent on the genetic line you have. But right now, there's no difference in recommendations for copper boluses in haired versus wool sheep. But I do think there's some research being done, and hopefully that is coming.
Okay. And then sticking with minerals, we get this asked every time we talk about minerals. Mineral buffet or a premixed loose mineral?
Oh, that is so hard, and I think that depends on how much money you want to spend. So I think in an ideal situation, I've heard some really good stuff on those mineral buffets. Now, I think part of also what we deal with is we just don't have the true scientific research immediately comparing those two aspects. So, if we could get funding to do that, I think that would be a great research project to see and then take liver biopsies in these herds to see which is better. I definitely have some clients that use the mineral buffets. I have personally not used one, and part of that is how much labor you're willing to put in managing those mineral buffets and ordering those specific minerals as well. So I think a lot of that goes down to a labor, how much you're willing to put in and managing those facilities as well.
All right, I have 2 more questions. Can our jugs be too big in addition to being too small?
Sure. I think yes. Now, I have no idea what that size would be, but I think they could be too big in that if they're not small enough to really force that connection between the dam and the neonates, I think that's when you're going to have them too big. Kind of one of the points of the jugs is making sure that the doe or ewe is going to accept both of her neonates if she has twins. And so making sure that your jug is small enough to kind of force that mothering abilities in that ewe or doe.
All right, and the last one I have for you today. Do you have a preference of feeding warm milk to newborns, kind of that limited bottle by bottle, or a cold like self-serve cold milk in a self-serve?
Yeah, and I think that totally depends on the age of the animal. And I think it depends if you're using a lamb bar situation. Serving that kind of room temperature, almost cold milk is necessary in order for them to not over engorge themselves at a lamb bar. But you're definitely not going to be able to do that in a complete newborn lamb or kid. And so making sure that they're old enough and your environment is warm enough, that way feeding them a room temp or a cold milk is not going to send them into an overall hypothermic state.
All right. I think that's all I have, all the questions I have for you. There were a few more, and I may send them to you afterwards, and you can answer them if you'd like or not. And we do appreciate you being here, Dr. Cowley. We did lose Dr. Salinas, and it looks like he's struggling to get back in. So I do want to announce that we have one last class coming up next week that will actually be me as your speaker, and I will be talking about the economics of fertility. And I know Dr. Akaria has something he would like to chat with you all about before we hop off here today.
So thank you, Dr. Cowley, for your nice presentation. We have an upcoming training program on peer group Missouri. That's like close to Springfield, Missouri. It's a hands-on training program on fencing. So there's a form that you can enroll in. Please help us distribute this information to other friends or producers. Thank you.
Thanks, Dr. Akaria. Thank you, Dr. Cowley. We'll see you next time.
Absolutely.
Thank you so much. I really enjoyed. Thank you.
Bye, everybody.